It is my privilege to introduce our keynote speaker for today, Dr. Kiran Kumar, a psychiatrist at Vydehi Institute of Medical Science and Research Center. We welcome you, sir. I also request Dr. Lingraju ji to present the bouquet to Dr. Kiran. Dr. Kiran, may we please request you to share your insights with us, please. Thank you.
Thank you all. At the outset, it's my proud privilege to interact with young minds. It's always wonderful to interact with young minds. I take this opportunity to thank TREDA for giving this platform to share some insights about mental health. Okay, these are my credentials. I practice at Vydehi Institute of Medical Sciences and Research Center, Bangalore. It's a 1,600 bedded medical college hospital, and I represent the Department of Psychiatry as professor and HOD. And these are my credentials. Next. So every time I speak, I take a forum, I wear different hats. I'm a clinician, I'm an academician, I'm a researcher. Next. So today I thought, what kind of an hat will I wear? Particularly when I'm addressing young minds like you, I thought, let me wear the hat of a mental health professional. I'll be a mental health educator to you today. I request you all to clarify any kind of doubts you have. What I'll do in the next 30 minutes or so is to take you to the nuances of mental health. How do we understand what is mind? What do we do to understand what is mind? And what can be done to understand the intricacies of mind and its disorders, particularly in young population. So today, I thought, let me address mental health and youth, particularly among college students. I see there are a few nursing students. I see students from different backgrounds over here. So let us see how mental health is important in a changing landscape. Next slide, please. We know that India is the most populous country as of today. I think it has surpassed China. Officially, we have a population of more than 1.4 billion today. The most important thing among that is 65% of our population is under the age of 35 years. So it's an young country that we are representing. In that, about 400 million of us belong to the age group of 10 to 24 years, and that is what the crowd represents today. That's an important population. If you look at this slide, when we compare the slide of India and China, we see a classical pyramid which is represented, the base is represented heavily by the young population, whereas in the China, we see that there is distribution. So China is aging, whereas we are an young population. So it's absolutely important for us to address this young population. The health of this young population is extremely important. The way WHO defines health is a state of complete physical, mental, social well-being, and not merely by the absence of disease or infirmity. Now, this is an over-encompassing definition. But unfortunately, the emphasis on mental health is alienated. It is alienated at all levels today, at the level of the individual, the level of the caretaker, the level of the family, the level of society, policymakers, lawmakers, etc. So the whole concept of mental, the so-called in inverted commas, is distorted. Please understand what is psychological or what is mental. The way we understand physical disorder, whenever there is a, next slide, whenever there is, the body gets affected, we call it as a physical disorder. The mind gets affected, we call it as a psychological disorder. The problem is to understand what is mind. The way we understand mind technically is cognition, conation, and affect. Next slide. Or the way we think, act, and feel. Okay, so simply, what is mind? Next slide, please. The way we think, the way we act, the way we feel. Okay, and this happens in all our daily routines. Now, if these are the three cardinal functioning of the mind, where is the mind located? The organ of interest for anybody with neuroscience background, for a neurologist, psychiatrist, for a neurosurgeon, or anybody from neuroscience background is the brain. So today when I say mind, the seat of mind is brain, and we are talking about disorders of brain itself, and nothing is in thin air. It's concrete disorders of brain that we are talking about today. The decade 1991 to 2000 was called as the decade of the brain. The way we understand brain today is in real time. We see the brain in real time in various aspects into neurophysiology, neuroanatomy, neurogenetics. It goes on and on. And today we are no more in the era of structural imaging. The way we see brain is functional imaging. We see brain in real time. These are SPECT and PECT images of a person who's treated for depression. We can see some pictures on how a depressed brain looks and how after treatment what happens to the brain. The whole idea is to convey to your people that today we are no more in the era where something is in thin air and we don't know what is happening. It is very concrete. We see brain in real time. We see disorders of brain in real time. So in that context, it is very important for you to understand why are we talking about brain, why are we talking about disorders of brain, why are we talking about mental disorders today, particularly for a very, very important part of the population, the youth. So that we can only understand when we understand what is the magnitude of psychiatric disorders. So according to WHO, about 450 million people worldwide suffer from some kind of neuropsychiatric disorders. Now probably you will not be able to conceptualize what is this 450 million. To make it simpler, we have about 1 in 4 of us will have a diagnosable, treatable neuropsychiatric disorder in our lifetime. So you can just imagine the magnitude now. There are few myths about psychiatric disorders, that psychiatric disorders occurs at some point of time. Why should it occur to children? Why should it occur to young population? We are healthy, we don't have any problems, etc. But if you look at the statistics, and these are global statistics, universal statistics, we see that around 1 in 5 of our children and adolescents will have some psychiatric disorders, and more than that, about half of mental disorders occurs before the age of 14. So by the age of 14, you already have a mental disorder. Okay. So that's what we are talking about. That's the emphasis on psychiatric disorders in children. Most of us think that psychiatric disorders leads only to morbidity. But why will they die because of psychiatric disorders? We know that people with severe psychiatric disorders die about 10 to 20 years earlier than the general population. So severe psychiatric disorders not only lead to morbidity, they also lead to mortality because of various reasons. What about the cost factor? The global economy loses about 1.4 trillion US dollars only because of illnesses such as depression and anxiety, which is the most common psychiatric disorders. We are not talking about the rest. The other important concept that is very, very important for today's discussion is suicide. People think that let us not talk about suicide. Why should we introduce this concept for an adolescent or an young adult? But we as mental health professionals are very clear that this is a topic that has to be addressed in the open forum. Suicide is one of the leading cause of death. About 8 million suicides occurs every year. That is about 1 death every 40 seconds. By the time I finish my lecture, there will be so many of them who would have completed and died because of suicide. The most important thing about suicide is for every 1 suicide, there are about 20 to 25 suicide attempters. Okay. So these are huge numbers that we are talking about. And the whole tragedy is suicide is the second leading cause of death in individuals aged 15 to 29 years. Now, unfortunately, that's the age group that I'm addressing today. It brings pain to me because when I say this is the second most commonest cause of death in young adults, the common question that has been asked to me is, what is the most commonest cause then? The commonest cause in this age group is road traffic accidents. So the tragedy is we are losing youths to 2 preventable causes of death, be it road traffic accidents or suicide. And suicidology is my area of specialty. So it is a preventable specialty. So we have to address suicides. We'll go back and readdress suicide, why it happens, what are the factors little bit later, but it is a very important determinant of mental health outcomes. So by this, you all know that the metaphorical expression, the magnitude is an elephant in this room. The magnitude is extremely huge. It is very, very common. It occurs everywhere, be it your friends, be it your neighbors, be it yourself. It can strike anybody, anywhere, irrespective of age, gender, population. Much more common in the young age group that we are talking about. So please understand, mind and body is not a dualistic concept anymore. It's an unitary concept. The way we divide mind, body, neurologists, psychiatrists, cardiologists, etc. are arbitrary. They are not watertight compartments. It's an unitary concept. Okay? It's a neurobiological construct. In that background, let us understand about mental health and college student. Here are a few questions that I would like to ask you, and probably you can answer at your own levels. Okay. Say yes or no to these questions. So answer the following questions. Too many things to handle. There are a lot of things in academic sphere, personal sphere, professional sphere, interpersonal sphere. Constant deadlines for all of you. All tasks are priority one, everything is priority one, nothing is priority two. There is no me time at all. Though we are surrounded by gadgets, we stay in a virtual world, but there is no me time at all. Efforts often seem nothing, don't get satisfying results at all. Only I have work. My friends are all enjoying. That's what we think a lot of times. Change in environment, relationship, romantic relationship, parents, sisters, etc. Reluctant to ask for help. There is help available, but somehow the art of asking for help does not exist. Trouble saying no. We take a lot of things onto your plate from all the spheres. It becomes very difficult for us to say no. If a majority of the questions are answered as yes, then welcome, probably you are in the right place to understand what is this going to lead to kind of thing. So there are a lot of academic factors among students, there are a lot of physical factors, social factors, emotional factors. All these things leads to a concept of stress. So the first and foremost thing that we'll be talking today is stress. From there we go to something called distress. From distress probably we go into the concept of disorder. Now the concept of stress is something that as professionals we have always addressed it, and not only as professionals. Today in the new world, there is the next slide, even the media has started recognizing that crisis of stress, mental health among students, among college students, students in campuses is enormous. So in that concept, let us understand what can stress lead to. Next slide. So stress and mental health is becoming extremely important in a changing world. Now, why do I call it as a changing world? Mental health in the changing world was a theme of world mental health, mental disorder, world health disorder that we, mental health day that we conduct on October 10th every year. This was one of the theme a couple of years back. Now let us try to understand why we are talking about a changing world. The world is getting polarized more and more today. That is adding to enormous stress to the students amongst the stress that I have already discussed. Particularly, pandemic showed that the stress is extremely important and the world has become really polarized. Now, why is it got polarized? We are talking about race and ethnicity. We are a multilingualistic country. Every college, every campus are representative of the whole of the country that we are in. So when we talk about local issues, there are a lot of local issues. There are issues related to race, ethnicity. When you look at global issues, if you go back to the world where the world has become a small village, when you go to other universities, campuses, race and ethnic issues are extremely common. Racial and ethnic minorities particularly have a greater burden of mental health needs and thus suffer greater loss to their overall health and productivity. So this is one area. Please note, we will not go into the details. I'm trying to emphasize what is this changing world that we are talking about, and each one of us will have an array of these issues that leads to stress. Gender roles, we always have that some gender roles, masculine roles, feminine roles, even mental health disorders have been genderized. If it is depression, then it should be in males. If it is anxiety, it should be in females. If it is substance use, it should be in males. But unfortunately, we know that it is not true, and gender roles that we have been identifying from time immemorial are becoming a little bit difficult to understand as of today. So are gender identities. We know that today we are in a world where gender identity is fluid. The concept of male, female does not exist anymore, and we have a whole spectrum in between, and each student have their own preferences. It leads to a lot of psychological, emotional issues in them. Orientation is one more issue that we are talking about, LGBTQ committee. We are becoming extremely aware of the psychological issues of this community. Many of us probably in this room itself will have a lot of fluidity in these areas which has to be addressed, which leads to a lot of stress and discomfort. We also talk about human rights. And we know that though we are students, a lot of basic human rights are being violated. Recently, I think you are aware of a lot of issues going on in a medical college in Kolkata, and the kind of human rights issues that we have been facing as students. So these are extremely important, leads to enormous amount of stress. So the question of human rights sometimes does not exist. Since we are a multi-dimensional country, I'm also talking about social factors today. We have enormous poverty, and the rich and poor divide that we are having is becoming very unequal in this changing world, again leading to enormous stress among the student population. The other important concept is the virtual world that we are living in. Yes, pandemic accentuated this virtual world that we are living in, and today, though human being is called as a social animal, we are no more social. We spend about 10 billion hours using social platforms each day. It accounts to about 1.2 million years of human existence. That's the amount of time we are spending on probably the social media. So today, we are no more social animal, we have become virtual animals. Okay. This has led to enormous interpersonal issues with coping, poor social support system. What India is known for was a family support, was a joint family system which is getting dwindled into nuclear families, now into virtual families, leading to a lot of distress, particularly among young students. So a lot of these external and internal factors leads to stress, and the outcome of stress we all know can be in different domains. It can be physiological or bodily symptoms, cognitive thinking sphere, behavioral symptoms, emotional symptoms. We'll just see what are the symptoms of stress, particularly in young students. Physical, multiple aches, body aches, headaches, physical aches, emotional irritability, short temper, feeling fearful, sense of isolation. Cognitive, lot of students say, I cannot concentrate, I forget, I cannot memorize, poor judgment. Behavioral, sleep disturbances, substance use, etc. can all be an outcome of stress related disorders. One point that I would like to emphasize as a medical doctor is, when I say stress, we are not using it as an English parlance of stress, we are talking it as a neurobiological stress. That is the whole of your system, that is endocrine system, metabolic system, neurological system, and your psychological systems are incorporated in the word stress. So each and every part of your body is getting involved, and that's the reason we have a gamut of symptoms. When there is stress, it leads to distress, and occasionally it leads to disorder. About 10% of them with stress can go on to a stage of disorder. Today we will just touch upon what is this distress and what is this disorder. The most common distress symptom that we have is burnout, extremely common among students, followed by substance use disorder, and occasionally the tip of the iceberg, few vulnerable students can develop psychiatric disorders. It can be common psychiatric disorders or common mental disorders, or very occasionally severe psychiatric disorders in a vulnerable population. This is the concept of burnout. Most of you probably would have experienced it. Suddenly you feel your energy is getting depleted, you are not interested to do any daily chores, daily activities, and you have reduced professional efficacy. This is because of chronic stress. The resilience is like a rubber band. The more and more you are going to probably elastic limit of the rubber band is going to break at one point of time. Burnout is before it starts breaking. Substance use, I would like to emphasize, even now when we were sitting and discussing, we were talking about the common abuse of substances. Substances have become very, very affordable, it is available, and youth start probably experimenting it for different reasons. The relationship between stress and substance use disorders is bidirectional. Substance use disorders leads to stress, stress leads to substance use disorder because of its easy availability, accessibility, and probably the whole sensation seeking behavior that youth have. They start abusing substances. But unfortunately, substance use, which can be an outcome of stress, or stress can lead to substance use, whatever is the phenomenon, can have a lot of mental health repercussions. And this has been covered in the media time and again, that substance use are a big no. They cannot be used as substances of coping for any reason. It leads to maladaptive behaviors and the outcomes are dreaded. Occasionally, few people can have frank psychiatric disorders, as I told you. Psychiatric disorders can be minor or major, and it's a spectrum. At one end, we have very mild symptoms, sleeplessness, eating problems, to depression, to severe disorders, to substance use disorders, to suicides. So it can be a spectrum of mental health conditions that can be seen. Please note, not every one of us with stress will land up in a disorder. Not every one of us stress will have distress. There need to be a vulnerability. Now this is what we explain by something called as a 4P model. This is called as a stress diathesis. So there should be a precipitating factor, like somebody failed in the examination and then I say they got into depression, he committed suicide. But not everybody who failed in the examination went on to have a depression, because the person should have a predisposition. The predisposition can be all the factors that I spoke to you about, the changing world. There can be some genetic factors, and there can be certain perpetuating factors in the family. Okay, there can be family background, alcoholism in the family, broken families, etc., that can lead to perpetuation. As I told you, not everybody with these factors develop a disorder. Lot of us have protective factors, and as youths we have to develop protective factors. That's what my next speaker, Dr. Johnson, will be talking about, positive mental health and how to foster these protective factors. So there need not be the precipitating factor that actually made the illness. It's the predisposition and the perpetuating factor that pushes you to a psychiatric disorder that has to be addressed in our routine. Along with that, we know that it's not so simple when I talk about psychiatric disorders today, because there are n number of factors. There are academic factors, personal factors, factors that started from your birth, and in the background there is a huge biopsychosocial model. There are a lot of biological factors, social factors and psychological factors that pushes an individual towards a stage of psychiatric disorder. It's quite complex, but it can be handled. Okay. Lot of students ask me a common question: when does a symptom become a disorder? I'm feeling sad. Do you mean that I'm depressed? I'm feeling anxious. Does it mean that I have an anxiety disorder? No. Whenever a symptom is predominant, when the symptoms is occurring throughout the day, it is persistent, it is there every time, it is pervasive, irrespective whether you're in college, whether you're in a house, whether you're with your friends. If these symptoms are persistent, pervasive and predominant, then is when we probably say there is a psychiatric disorder. So it should be persistent, it should be predominant, and it should be pervasive. So a couple of slides on what is the outcome and what are the common psychiatric disorders that we talk about. Common mental health issues that you need to recognize. Why I'm naming them is so that we understand that these are disorders. When I say disorder, I'm trying to blame the illness rather than the individual or the person, and we don't personify the disorders, that you are depressed, you are suffering from depression. So there can be generalized anxiety disorders, social anxiety, which is extremely common in youth. Depression is a second common disorder. Anger, irritability issue at a symptom level are extremely common in young adults. Substance abuse, any substance, we are talking about licit or illicit substances which are easily available. Suicide, as I told you, please note, if somebody is talking about suicide, be it your friends, be it your colleague, be it your family member, one thing that you can do is talk to them. Try to understand what led to that, what are their thoughts, have they acted upon it, are they planning about it. So just talking to them at your level, trying to address it and probably referring it to a counselor or a mental health professional is going to solve problems in a lot of cases. Sleep disturbances are again very, very common, because we stay in a virtual world, we have enormous stress and there is no time for sleep at all. Eating disorders, particularly among young women, is again extremely important, either in the form of excessive eating, excessive concern about the way you look. And adult ADHD, again a common thing, because if you Google, you say that you are inattentive, you are impulsive, you cannot control your impulsivity. So these are symptoms of adult ADHD which can impair your academic performance. There are other things, major mental illnesses, which we will not talk about today. The worry is, what are the consequences of these common mental disorders in your life? So the outcomes, it's quite general knowledge or common sense to understand what are the outcomes if you have a disorder which is going on and on. There is distress, there is poor academic performance, poor social performance, there is poor quality of life, substance addiction and behavioral addictions as an outcome, suicide as an outcome is extremely common. mental illnesses can lead to aggression, violence at times, unhealthy habits, eating habits, substance abuse, poor physical health, suicide or self-harm, and poverty and legal issues. These are the huge concerns that we are talking, and we are talking about in a very, very important young population today. The question is, we understood the magnitude is very high, it is very, very common. There can be a spectrum of psychiatric disorders in youth. The question is, so what? Please note, there are about less than 10,000 psychiatrists in India as of today. These are numbers because we have something called Indian Psychiatric Society, which is a registered body. Less than about 2,000 clinical psychologists, very few psychiatric nurses, and India spends a meager 0.606% of its health budget on mental health. Okay. So these are absolutely pathetic numbers. According to some media reports, India is short of about 60,000 psychiatrists to meet the global standards as of today. So in that context, we are talking about two elephants in this room. There is a huge magnitude, and there is dearth of mental health professionals to address these needs, which are very, very common in young youths. So what should we do? What should all of us do? So it's time that we all join hands. It cannot be done by one mental health professional where there is acute dearth of them. So it's for all of us to join hands, make us understand that there is no health without mental health. Mental health is extremely important. Identifying, accepting that there is a mental health issue, trying to balance out mental health issues and see how it can be controlled is the need of the hour. So with that, I would like to end my presentation, and I would like to hand over it to the next speaker. Thank you very much. Any questions?
Thank you so much, Dr. Kiran, for such a wonderful insight, full of knowledge into mental health, the statistics, the illness, and above all, that big picture which speaks for itself. The brain, how it is when someone is without depression and with depression. Thank you so much, sir. Also, if anyone has questions, we are more than happy to take it, or towards the end of the session, we can also do that. Does anyone have any questions? Dr. Kiran is more than happy to take them.
Good morning, sir. Thank you for a wonderful session that you've given us today. My question was, like you mentioned, that we have a limited clinical psychologists in our country at present, and we are seeing that there are new policies being introduced, more stringent criteria for getting clinical psychologists, like getting students into the program itself. So how do you think we can move forward towards having more clinical psychologists if the criteria are just getting more stringent?
Your question is more clinical psychologists with respect to?
With respect to the new, we have a new educational system coming up for psychology itself, right? Where we have BSc clinical psychology being introduced, and there's going to be only a limit of 30 students or so, if I'm not wrong. So we already have a lack of clinical psychologists in this country. So how are we supposed to move towards encouraging more students to join clinical psychology if the criteria just keep getting more stringent and there's no clear path for that? So
see, we know that there is a huge magnitude. There is a requirement. So the only way to address it is by capacity building. Now capacity building is coming up with new resources. Okay. Once we make them understand that it is extremely important, and there will be a lot of opportunities in future at different levels, at the level of schools, colleges, occupational psychologists, clinical psychologists, etc. More and more people will probably take it up, and it is going to benefit the society at the end of the day. Thank you.
Thank you, Dr. Kiran.